Yeah.
Hey,
Hey, buddy.
what's happening?
Looking good.
What's that?
Looking good.
No, how come?
I've been dealing with a lot of stuff about the false information on my medical records.
Okay.
I called a clinic that did that to me. Chaz. Spokane. I talked to a risk manager instead. They told me I was going to talk to CEOs. They didn't. They said, oh, you can't appeal on this. We already decided that not people at all.
Okay.
They want to give me the number or address. Can you send me to report this area, please? You know, I can show you. It's saying I'm a danger to myself and others. It says I'm gypsy. Geez, I'm paranoid. I'm not that. I have video evidence of me disproving all this shit. You know. And she called the cops on me first to tell me I want to appeal. I have to sue the police department now too for obstruction.
All right. Well, that sounds like a bunch of stuff that's not even fun to deal with.
Right.
Well, as far as what I can help you with,
Yeah.
there's some good news as far as so you were in the ER,
Yeah.
had a CT scan,
Yeah.
which is a really good study to look at stuff. You do have it's a very small hiatal hernia, so there's not stomach up in your chest. It's not affecting your heart. So all that stuff is
right now.
So, and then that swallow value did,
Yeah.
you're refluxing. So I think probably some of the pressure you feel is probably reflux.
I'm keeping my neck too.
So yeah, and I don't know why it'd be coming up in your neck, but certainly the discomfort right here is probably from some reflux. But the hernia is small. You don't have all your stomach's up in your chest. It's not pushing on your heart. So
Sure.
Yep, absolutely. Absolutely. We've got a CT scan. We've got an EGD done by Dr. Morgenstern a year ago, which saw a very small hiatal hernia.
Right.
And then the swallow valve, which shows a very small one. It does show some reflux.
Right.
So I have no question that some of your symptoms that you're feeling, some of this discomfort, burning, that stuff is reflux. I mean, reflux is nasty. It's not, people don't, it makes people miserable. You don't have to worry about it affecting your heart and that kind of stuff. There's not a big enough hernia to affect that. So that's the good news. So some of that stuff, it can at least sort of maybe give you some peace of mind that you don't have a whole bunch of your stomach up here that's pushing on things. And
It's been bothering me for 6 years.
Yeah, reflux sucks. Reflux is not even fun to deal with.
I was eating 500 pounds a day 6 years ago.
Yeah.
I thought 30 pounds before it became a problem.
Yeah.
And I was gaining weight.
Yeah. So, well, like I said, reflux it gives people chest pain, it gives people burning in their throat, it gives them epigastric pain, it makes them feel sick all the time. It's not even fun to deal with. So when we have that kind of stuff, there's a couple things we do. Medication, omeprazole, which I think you're on.
76 3 times she was fill that prison. It's not there.
Okay, well, that's our first thing to do, because if we get you on some omeprazole, all that stuff may go away.
Maybe stronger than 40 milligrams.
We can start. What pharmacy do you use?
Walmart.
Walmart. I will put in a prescription today to Walmart for omeprazole 40 milligrams daily.
Okay.
So let's start with that.
Okay.
Now, if we can't control it with meds, then we want to talk about, well, maybe surgery is an option, because for some people it is, although it's a big surgery and it can have issues.
I know.
If we can control it with meds, we like to do that first. So
I don't want my son cut open either.
Yeah. Well, so the treatment then is we get you on omeprazole, and we give it 4 to 6 weeks. And if you're like, hey, as long as I take this, I don't get that burning and that pressure, this is great, then you just stay on it. If you take that, you're still like, I don't know, maybe it's better, maybe it's not, but I'm still having all this issue. I can tell when I'm getting stuff coming up. Then we can talk about surgery as an option. There's a couple other things.
I put out paper online. I'm having all these symptoms except vomiting.
Yeah. So you're not regurgitating badly, which some people are. That's a good thing.
You know, the biggest thing is stress.
Yeah. Well, some of it, like I said, stress doesn't help your reflux. If you're stressing, if you were stressing prior because you thought there was something horribly wrong here that was affecting, you could rest easy with that. So all the studies we have, you've got a small hiatal hernia, and we know people with hiatal hernias reflux. So I know you've got acid coming up.
Right.
Most time, if we can just knock that acid down, so you'll still have some stuff coming up, but if it's not acid, it won't give you chest pain, it won't give you that burning, and you'll feel better.
Now, there was a treatment I heard about years ago when I was a kid. They told people like with ulcers, take Tums, like more than you need.
Yeah. the thing about Tums is, Tums is it's calcium, so it's going to coat your stomach,
Right.
which is going to help if you're actually having issues right then.
Right.
But it's not going to prevent it from. So the thing about omeprazole, what it does, it gets in your bloodstream, and it stops the glands in your stomach from producing acid.
Right.
So it's long term. You have to take it every day. It's not like, oh, I have reflux, I'll take an omeprazole, because it takes too long for it to act. So it has to you take it every day, it gets built up, and your stomach won't produce as much acid.
Another issue is I didn't have a doctor for a while.
Yeah.
So my medication, my blood thinners especially, I was stretching them out.
Yeah.
A month will last me 2 months.
Yeah.
3 months.
Yeah.
You can't do that.
No, you need to, especially blood thinners, you need to take those.
I know.
Because next thing you know,
That's
you
why-
get a clot.
That's why my blood pressure is a little high.
Yeah.
I know.
Well, so, I know you got a lot of other stuff going on and fighting with everybody with that stuff. As far as our work here,
Yeah.
you got reflux.
Yeah.
We've got proof of it. Let's treat it, see if that makes you feel better.
Okay.
So some of the stress about, hey, is this affecting my heart? Am I going to have a heart attack because of it, all that kind of stuff? Don't stress that. It's not to that level.
Okay.
It's not that significant. You have a small hiatal hernia. You have reflux. You and 90% of the rest of the patients I see.
Okay.
Everybody's
You know,
got
I'm stressing is I told you about that phone call.
Yeah.
I have to call from the cops. I'm going to sue you now. That's not good for this at all.
No.
You
No. So, well, what I can do to help is let's get rid of your reflux.
Okay.
And that'll make you
You
feel
feel
better.
the favor. I'll love you forever. Tell me how to peel that shit on my medical, please.
Oh, I have no idea. I don't know.
Who would I call?
I mean, if there's something on your record that you feel is
It's not. I feel it's definitely false. It's that I'm a danger to myself and others. I'm paranoid. I'm delusional.
whoever put that in your chart, I guess you would have to call the facility they're at
I did.
and tell them that
There's
you
someone
want
that
your.
wants to call cops on me.
Yeah, I have no idea. I don't know anything about the legalities of the
medical
system.
board, or I don't
So,
know.
yeah, I don't know. I have no clue. I don't deal with legal stuff and that kind of stuff.
I told Stephanie because she saw it in the papers at the dark side herself. You know, and she said, "I'll treat you different. I'll treat you. That's not good enough. I need it off because I can't get a doctor to listen to me. I need you to listen to me. But before they were like doing paperwork, I said, this is the wrong. This is on. I'm not there, and I can't get a gun. I can't fly now.
No, Lord.
You know."
Well, like I said, when you come here, I don't really, I don't even kind of look at that kind of stuff. When you're sitting here in front of me, when you're telling me what's going on, we have objective evidence. You do have reflux.
Yeah.
That's going to give you symptoms. I know you're feeling that stuff. I can treat that. And so let's try it with meds. And if we can't get it done with meds, in a couple months, if you're still like, these freaking meds ain't helping me,
And
then we can talk about surgery.
somebody to help me lose weight again.
So-
Please.
Well, weight stuff is,
If I have health problems, I lose weight like a champ.
yeah. Have you seen it? Do you want to see a nutritionist? Does it help?
Sure.
Let me ask these guys. I think they have one
I
here.
was born, my doctor knew about it before. I had unbelievable success with it. HCCG.
Okay.
I was ejectable. I used it for about 3 or 4 months. 80 pounds in
Yeah.
1 year.
Yeah.
My life changed.
Yeah.
I was 29 in waist.
So-
Guy,
Well, I mean, like I said, we can send you to they've got a nutritionist or a dietitian here that can help you do that.
Because I definitely
that
have
kind of stuff.
circulation problems too, Doc.
Yeah.
If it's cold out, I can't use my heat because my baseboards are unbelievably expensive.
Yeah.
I paid for 1 week last winter, $250 heating bill.
Yeah.
My temperature just go white.
Yeah.
Oh, I feel like this.
Yeah. So who are you set up with to do your primary care stuff now? Or do you have
Stephanie Woodlock.
Okay.
I'm not satisfied with her.
no? Where's she at?
The other 2 doors over.
She's not. You're not Chaz. You're not with Chaz.
No,
Okay.
I think they're shit.
So, well, I don't know. You might just go in and tell them you'd like to see somebody else. Just tell them, hey, I don't feel like she addressed my stuff, and I need to see a different lady.
The doctor, I know for a fact, if they see something that's inaccurate on my medical, I'm supposed to report it. I'd say, I don't know, or I don't want to reach you like that. Say, is this affecting your civil rights? Okay, I'll call the medical board and try to figure this out. You're supposed to do that.
So, well, I go over there and say, hey, this hasn't gotten straightened out yet, and I want it straightened out.
She sent me 3 times in emails.
You might have to, usually with that, like with our clinic, because I work mainly up at Syringa,
Okay.
But if there's stuff that needs to come off charge, the stuff that needs to be dealt with patients, usually the office manager is the one that takes care of that. So you might go over there and just ask to talk to the office manager.
There's that, and it says my chart, I drink and take marijuana. That's not true for almost a year now.
Yeah.
Because I can't smoke marijuana. I'm on housing.
Yeah.
How's my housing?
Okay.
I'm not stupid.
Yeah.
I try to drink, but that hurts.
Yeah, well, the drinking's gonna make your reflux worse.
I know.
For sure.
I know.
So I'm gonna send medications over to Walmart for you. So it'll be there, 40 milligrams daily. Okay.
Yeah.
We'll do that for about 6 weeks.
Okay.
And if it works for you, fantastic. We're done. That's it. Just take it.
Okay.
If it doesn't, we can talk about what else we can do.
Okay.
Your medical stuff, I probably would go over there and ask to talk to their office manager.
Okay.
Just tell them, hey, there's some stuff in my chart I need taken out of here. How do I get that done?
Okay.
The docs probably aren't going to know because we never know.
Okay.
It's usually whoever's managing the office.
Okay.
All right.
Okay. Thank you.
Okay. Hold on a second. I'll tell Dusty what the plan is.
Okay.
I'll send those meds over. Okay.
Thank you.
All right. You bet.